Healthcare is changing, and really all payers want to pay for quality healthcare, not a quantity of healthcare. And what we've seen with our experience in the industry is every payer's program is slightly different, or they want a different quality metric, or they have a different electronic medical record. And so we have been working the past 3 years developing a tool and a resource that we offer. It's really, we feel like, impactful and powerful to be able to quantify that and bring it up into an executive summary level so that business owners, decision makers, physicians, or executive boards can see where the real value is.
So when I go into a client's office, I actually get to work one-on-one with the providers, and I get to help them take their medical expertise and the things that they do in the room with their patients on a day-to-day basis and put that into their electronic medical records and produce a progress note. So one that you can actually read and make sense, and then two, one that is compliant with the documentation, the coding guidelines, and then most importantly, to make sure that the providers are documenting what is most relevant to their patient on that date of service, and they're not overcharging or undercharging, and it's very important to help them learn how to take this data and put it into their electronic medical records in a way that is structured and that captures all of the things that they're seeing the patients for on a daily basis.
I work with clients on ensuring that they are meeting HIPAA compliance requirements, from privacy policy to the security policy. We usually have a routine meeting once a month, and we talk through what the policy requirements are for both, again, privacy and security, but then also taking that and ensuring that we are including what their current policies and procedures are for their practice, so that we're not giving an overarching policy but that is specific to their policies and procedures, and then also taking that and ensuring that we are meeting, from a security standpoint, requirements for example, password, and making sure that they have appropriate access controls, and that we are really lining everything up to ensure that their compliance is as strong as possible, and that they are meeting those requirements but also making it to where it fits their business need.
I think the goal of our healthcare consulting for all of us is to be the trusted advisor for our clients. Valerie and Kinsey and I come from a different backgrounds. Kinsey's from the payer background, Valerie is more of a clinical background, and I've got the coding and the billing, chart auditing kind of background. So when we go and visit with our clients, we can pretty much help them with anything from the front desk to the back desk to working inside their EHRs, mapping some of the things in the EHRs, training their staff. When somebody asks them, hey, what are you doing for MIPS this year? I want them to say, well, you need to call Lori, or you need to call Valerie or Kinsey, because they're the ones that that we trust to take care of that. And so that's very important, that our clients trust us with that big piece of their business. If I can go home at the end of the day and feel like I have made a difference in the way that they see their patients and how their clinic flows, then I feel like I've done my job, and I've done a good job at it, and that's very rewarding for me.